We know there are a lot of companies that speak about that the people are the greatest asset, but if you go into the organizations, some of them will not be demonstrating it by their behaviors. And so I'm wondering, what are the things within maternal child health and within public health where we can take an effective business model? Everybody's always saying the healthcare industry needs to borrow from other businesses, other industries, what we need to bring in. And surely we do, if it's reasonable and appropriate. But there are industries that have not accepted the strength of people power, what is needed to get the work done. And I think that the kind of people historically who have been attracted to helping professions and to fields such as education, social services, and healthcare many times have a natural leaning toward wanting to think of people as the greatest strength and not the computer only. Not that we don't love computers, but that the people are the greatest strength. And how can we continue to capitalize on that and take what seems to be an inherent natural talent and ability that comes, but in some settings gets drummed out? Be more businesslike. Do it this kind of way. You know the implication of there is only one way. And yet, the full circle can come back, as I think we're all saying today, which is that we have ways, for instance, we mentioned earlier mentoring and coaching. And I don't want to get ahead into mentoring and coaching if this is not the place, but the concept of using the help that other people have to offer. Whether it's somebody mentoring me, that we talked about people important in our lives in an earlier time, or whether it's an organization that has a particular piece of knowledge or lessons learned that it could only have learned by being in the trenches and trying to put in place, say, an obesity prevention program, as I was learning from one of the states that works in the organization with me. And I saw last week and the week before that other states were listening to those public health departments with their successes and their lessons learned. They were learning from each other informally and richly. They were speaking it, and then they were putting it into practice. That's a great help for developing not just a people, but a place. And I commend all those who are good at doing that and want to encourage it in any way I can.
I've been surprised at how regular the performance appraisal system is within the federal government. They have that down. So trying to link, you do mid-year reviews. It's it was much more formal than it was in a university environment. I found that having some discussion, taking that opportunity to have discussion about development and let's look at our course for the next year, next 5 years, and where we want to be and how we can get there. That's a moment in time. But I've also found that, for example, within our bureau, several folks who were division directors came around a table and said, we really need to build in different structures for developing our people than exist currently. This came about in a very informal setting after a block grant review, talking about, we're having this experience as 3 professionals, but young folks in the office don't get the opportunity to experience this. How can we build this into the culture? And it's making things more fun, taking opportunities to build staff development into some existing things like performance appraisal system, but also we're experimenting with some speed dating ideas, speed mentoring ideas. Make it more fun, make it something that people look forward to participating in. I think that's an important strategy. It's not another, within the federal government there's lots of required training, and most of it is very knowledge-based, not personal growth-based. And we're trying to find that balance of, you have the required things, you have the performance appraisal system. Let's add some fun, something you look forward to, and you see this as a lifelong process for you. Those are some of the strategies that we've taken. But I think also hearing it from the top is important. The importance of developing people, and hearing a consistent message from the person at the top of the organization about their commitment to this is important. For supervisors to accept this as part of their responsibilities, as well as each of us as individuals, I think those are aspects in my mind that have been important.
diversity is an interesting place. I mean, because there's different people doing different things here, if you will, and there's different systems of appraisal. You have the students who, we're about, in large part, people development. That's the main thing besides knowledge development that we're about. But the focus really is ordinarily on the students for that. When it comes to certain routinized, personnel management kinds of things, it's just like the federal government or the state government where I worked or whatever. It's got its rigid sort of practices which need to be in place, and which one, must use to some extent, but as Laura, you were saying, I do things to sort of make it work for me, with my sort of, and you're allowed to do that. When it comes to faculty, it's sort of a little bit different because pupil development it's intended, the whole academic sort of headset and culture is, you're an academic, you're a faculty, you got to go, you're responsible. That's how you prove yourself, is your independence, kind of work. So just as a short sort of summary of how it's different within universities, but one of the things that so there's a lot of opportunities for all kinds of growth, and that's sort of accepted on a conceptual level with staff and so forth. But on a practical level, the pace and you still have the same challenges as in large organizations or government. The pace, the expectations are such that you have to really make a conscious effort for your people, your staff. I'll put it in the staff context because you have staff and students. To allow that to happen and to make it happen, and I think that's a real critical thing. And one of the things that I like to think of in terms of working with the staff around this is not only through the review process or not the review process or appraisal process, but some way or another talking about what they need to do the job that they're been hired to do. But also, one of the things I've always done, and I think it's been successful some way, is find something else. What do you want to do? Forget the job. What do you want to do and learn? And to the extent that I can make it relevant and use resources and tie it to what we're doing, I do that. But really help somebody achieve their goal, whether or not it's consistent with my output units goal. And I'm trying to negotiate that because it helps them get through the rough spots, and I think it's a real demonstration of trust and commitment to the individual. I've gotten a lot of that, so I've been able to sort of do some things in those contexts here which I might not be able to in government, or you can in small organizations.
Yeah, I mean, I think in a small organization, it's a blessing and a curse. We have 23 full-time staff at AmChip. One personnel administrator who does a lot of other stuff other than human resources. And so people development is crucial because we have such a small staff. Everybody has to really contribute and perform highly for us to get where we want to go. But we don't have the resource of a large organization or a bureaucracy where there's a huge department set up primarily for training. So performance appraisal is something that every organization has to do. You have to evaluate how your employees are performing and doing their job. But I have a lot of issues with traditional performance appraisal systems that focus primarily on either the weaknesses that you have or how nice you are versus, or how well you play with others versus how you're actually contributing to moving your organization forward. So while we don't have a rigid performance appraisal system in a big bureaucracy might, the flexibility of being at AmChip, of having a small organization is good because it lets us think through, okay, how do we want to do this? We don't have a lot of systems and processes. So performance appraisal is something we do, but instead of tying it to the way we've always done it or the way we have to do it by law or whatever the unions or whatever those other outside factors that determine what a performance appraisal looks like is, we have a little more flexibility. And we've started to use them more, not to focus on individual job performance as much as how is it what you're doing is moving our organization forward and contributes to our strategic goals and directions as an organization. And I think a lot of what performance appraisals miss is connecting individual work and how well that's done to the organization's mission and vision and what it's trying to do and how well people do that. And so I think being at a smaller organization gives us a lot of flexibility, but sometimes I wish I had the resources of a university or a federal agency where there's so much available out there.
Well, that's where partnerships around development make all sorts of sense too. I mean, as a training branch chief, I'm allowed to think about these, spend time thinking about this. It's a wonderful luxury. But I've worked in a small organization that happened to be university-based as well, so I recognize those sorts of tensions as well. But I think there are opportunities for reaching across organizations for developing people in the field of maternal and child health that we need to continue to take advantage of too.
And I think making it not just the HR director's job. I mean, really, everybody's
I don't even know
seeing.
who our HR director is.
Everybody's seeing.
Let's cut that from the
people development is part of what we're all there to do.
Right.
I think that's really important.
Well, and I think that brings up too a notion I wanted to mention earlier on is, to me, people development is a very democratic kind of concept, and it really is peer. I mean, it can be peer, it can be peer to peer, and that's where sort of there's a lot of that goes on like at the faculty level here, but just in general across organizations, peer to peer, and so forth, and as opposed to. We think sometimes about professional development or bringing people along in their performance, in an organization. We think about it's always one up, one down kind of thing, as opposed to really having the responsibility to help each other along and walking with. And Mike, you mentioned earlier something about team, but I think there's so much that just doing things with people and in pairs and shoulder to shoulder doing certain tasks, whether it's helping collate for a certain mailing of research surveys on occasion, to co-facilitating someone to somebody who's maybe an advanced researcher but hasn't been thrown into facilitating kind of roles or a chairing role or whatever it is, people pairing with other people and just seeing that as something that